So let's talk about complications in phalloplasty.
Okay.
And again, there's several different kinds of surgeries that can be done. If you could just break it down by the type of surgery and some of the complications that are most common in those surgeries.
Yeah, I think, regardless of the phalloplasty technique, phalloplasty has a very high rate of complications, much higher than vaginoplasty, approaching 100% in some cases. So almost everyone's going to have a bump in the road or complication. But we can break it down into into the source of complications. So the urethral complications. So for patients who have a urethra placed in the near phallus, that complication rate is about 50%. There are some very high volume centers that have brought it down to 30%, but even some of the high volume centers are still about 50%. That means 1 out of 2 folks will have some trouble in the urethra. And the trouble can be a narrowing of the size of the urethra, which is called a stricture, so you have trouble urinating and emptying your bladder, or it can be an abnormal opening, which is a fistula, so you can spring a leak, like a watering can kind of a situation. So about a 50% overall rate of complications there. You can have flap-related complications, so the outer phallus flap itself may have some sloughing, some partial loss of tissue, depending on the series and the source of the flap. That rate can be about 5% to 10%, so 1 in 20 to 1 in 10. Most of the time that is taken care of with local wound care. And then you can have flap loss, so the blood supply to the flap completely dies, and we have complete loss of flap, and that's give or take about 3%, 1 out of 30. So uncommon, but not unheard of. Mm-hmm. And as you can imagine, I mean, that's such a devastating, kicking the gut for the patient, for their families, for us to, not only you lose the phallus, you lose a donor site. Obviously, you can't reuse that donor site. It's a big setback. So thankfully, it is uncommon, but unfortunately, it's not unheard of. So those are the broadly speaking, the complications. Now, because the urethral complication rate is so high, there are many patients, and I think the percentage changes year to year, but there are many patients who elect not to have a urethra put in the near phallus. So they're content sitting down and urinating, and they just want to have something that looks like a penis, or works like a penis in terms of sensation and sexual function, but don't necessarily have to, they're not wedded to the idea of urinating from the tip of the penis.